Home treatments for plantar fasciitis. The important point here is whether or not you actually have this condition. There are other conditions that may cause heel pain. If you have not been diagnosed by a doctor, but feel you may have this type of heel pain and you are not in severe pain, then you can certainly try a few of the following suggestions with this cautionary note. If your pain does not improve and in fact seems to be worsening, then you should seek medical care, as there is a good chance you may have another problem. Night splints for plantar fasciitis. If your pain seems to be most evident when you first get out of bed in the morning, which by the way, seems to be the most common complaint I hear from patients, then using a night splint may prove to be very helpful. The reason for this is due to the plantar fascial ligament tightening up during the night, so when you take those first initial steps, the stretching of the ligament is very painful. A night splint works by keeping the plantar fascial ligament stretched during the night, making those first initial steps in the morning less painful. Plantar fasciitis shoes. In this instance, it is not so much what shoes you wear, but rather what shoes to avoid. Since plantar fasciitis in many instances is caused by overstretching the ligament, wearing flimsy shoes or even walking around barefoot for prolonged periods will aggravate the problem. Poorly supportive shoes like flip-flops, ballerina shoes, flat sandals and any other shoes with poor support will slow down the healing process and actually, in many cases, be the cause of your heel pain. Medical grade orthotics. If you happen to be overweight or have a job where you are on your feet all day, particularly on cement surfaces, then a store-bought arch support is probably not going to do it for you. The problem with most store-bought devices is that they attempt to cushion the problem away rather than support the plantar fascial ligament, and keep it from continually overstretching. The solution is to try a medical-grade orthotic. These orthotics actually support the plantar fascial ligament and do not allow for overstretching. They can be quite effective. Plantar fasciitis massage. A lot of physical therapists, in treating heel pain, will perform deep tissue massage. By massaging the painful heel, two things are accomplished. The plantar fascial ligament loosens up, thus reducing pain. The stimulation increases blood flow to the area, which helps the healing process. Stretching exercises may also help, especially in an effort to relieve the pain experienced when you take your first steps in the morning. By stretching the foot, prior to getting out of bed, the foot tends to be less painful. Oral and topical medication. Taking a controlled round of anti-inflammatory medication for 10 days to 2 weeks may help relieve your pain. Topical medications, such as those that make the area feel hot or cold, are harmless enough to try, and if they reduce the pain, that's even better. Just remember, these types of medications are skin irritants, which give off a feeling of hot or cold and essentially mask the heel pain, making the heel appear to feel better. There are also prescription topical anti-inflammatory medication which can be rubbed into the painful heel. I have never had much success with them, but there is little harm in trying them. Ice or heat for plantar fasciitis. Icing. If your heel is very painful, then icing it can reduce the symptoms, but ice does nothing to heal the area, it just reduces pain. Apply an ice pack for 15 minutes on, 10 minutes off, then repeat. Heat packs, on the other hand, particularly moist heat, is used to help heal the area. Heat brings increased blood flow to the area, which carries the nutrients needed to help resolve the problem. Heat can be applied continuously, until the heat pack cools down, then reheat and repeat. Read the full article at www.foot-pain-explained.com/heelpain.html.